Okay, good evening, everyone. Welcome to another edition of question and answers on mental health issues with Dr. Edebi. Thank you for joining in. I'm just going to give maybe 1 minute. Just wait for a few persons to join in before I go right in. But however, thank you so much for joining in. People can always watch the video afterwards. So today I will be kind of concluding on the conversation I started last week. Before I go ahead to deal with the question and the topic I will be addressing based on the questions asked today, I will just want to once again establish the fact that all through the month, all the Mondays, all through the month of August and September, I will be answering questions on mental health issues. So you can send in your questions. You can drop your question here. Drop the question here on the comments, or you can send in your questions ahead. Let me just confirm the number you can send your questions to. You can send your questions there, and so you can send your questions to +234 81 60 57 0317. It's a WhatsApp line. You can send it via WhatsApp. I'll take that number again. You can send in your any question on mental health. You can send it in, and I will be glad to attend to any question all through the month of August and the month of September. I will be answering questions on mental health. Any question on mental health. Once again, I take that number +234 81 60 57 0317. Okay, so let me go straight into it. So last week I started the conversation on panic disorders. Panic disorders. Now, I did say last week that all through my training at where I trained, which is Neuropsychiatric Hospital, Aro Belpta, I did not see one case. I can't remember seeing one case, but coming out into regular practice where you are practicing in the general hospital alongside other physicians, I've come to see that this is quite a common condition. And the reason why you don't often see people with panic disorders go to a psychiatric facility is because most times it is not seen or understood as a psychiatric illness or a mental health issue, and sometimes it's often misdiagnosed. But my big joy as I talk today, my big joy is that after last week's video, someone sent me a message telling me how for over 10 years of treatment has been receiving treatment and has been kind of given a diagnosis, but after watching the video, the person said the symptoms that I talked about relating to panic disorder were the symptoms she had been experiencing, even though it was called another, it was labeled something else, and she was being treated for something else, and she wasn't necessarily getting better, which kind of it makes me so excited. Messages like that just excites me about why we do what we are doing, because two of the major reason why I do this broadcast and we do this is, one, to demystify mental illness, to make it an everyday something you can relate with, because it's out there, it's real. Many people don't talk about it, but it's out there, it's real. And number two is to empower people with the right tools as regards their mental well-being. That's the major reason why we do what we do. So messages like that just makes me so happy that someone out there has been informed and then will take the appropriate step, because information is power. Information is power. I will encourage those of us who tune into Spread the Word. It's every Monday for August and September, and you can send in your questions on mental health, and I'll be so glad to answer them. And you can ask them even now as the program is going on. You can also do that. So you can ask them now, put them in the comment section, or you can ask them later. You can send it to the number I talked about. So that's just a bit about the preamble. I am Dr. Otefe Edebi. I am a consultant psychiatrist and a psychologist, and I'm the medical director of Grace Hill Behavioral Health Services, the Grace Hill Place Hospital, the managers of the Grace Hill Place Hospital. We are celebrating our 3rd year anniversary, and I'll be talking about one special thing that we are going to be doing in celebration of our 3rd year anniversary. I'm going to tell you something also special at the end of our conversation today. So to go straight into it, last week I started the conversation. I'm going to just give a brief cap, and today I'm focusing on overcoming panic disorders. What are the things? I put them into 5 steps, 5 things you should know about how to overcome panic disorder. If you know someone who's experiencing it, this is one video you want to share with them and tell them to watch. So let me just recap some of the things I talked about. So panic disorder is, as the name implies, it's a sudden surge of fear that people experience that is associated with physical body symptoms. So it is not just a surge of fear that is standing alone. Is that usually you have bodily symptoms, and then there's this surge of fear associated with it. Now these bodily symptoms they could occur in various forms, and I listed quite a number of them. You could watch last week's video. It's on this same page, and you could watch it, and I listed a lot of, but let me just recap a little bit some of the symptoms I had mentioned. So with panic attacks, often you not in any particular, so some people may experience the same symptoms all the time. Some people may experience different symptoms at different times, the same individual but different symptoms as it progresses. And this can range from heart beating fast, feeling that your heart is beating very fast, and which is associated with increased pulse rates. It also sometimes feels associated with this tightness in the chest or pain in the chest. Some people experience pain, some people experience a tightness, some people experience some form of fast breathing and finding it difficult to breathe. So there's this choke, like almost as if one is choking. And with that also comes, sometimes some people experience dizziness, lightheadedness. You feel like you are going to pass out. You feel that way. You know, some people experience that also. Then some people experience abdominal discomfort, which could range from things like, oh no, so sorry about that. The call came in and kind of interfered. Okay, so some people experience some form of discomfort in their abdomen, and then it's associated with diarrhea, so they need to go to the toilet, or just a bloating of the tummy, you know, so there's discomfort like gas in the tummy. Some people also experience weakness. They just feel so weak, and often they say, I'm so weak, I'm so weak. Those are symptoms. So these are the bodily symptoms that occur with panic disorders. And then another symptom some people experience is something called depersonalization, where it seems like things are not real, or they feel they are not real, or things around them are not real. So you might have someone say it feels like the person is maybe talking to you and saying, am I communicating? Am I making sense to you? Because the person doubts themselves. It just feels like things are not real. We've even had people describe moving from one place to another and feeling like that didn't happen, you know. So there's depersonalization, there's derealization, there is the there could be hot flashes or cold flashes, there this internal heat or internal chills, there could be sweating, there could be numbness. So sometimes some people say, because they're experiencing some form of numbness, they are concerned that maybe I'm having a stroke, you know. So these are a range of bodily sensations that people have. Last week I established that and I informed us that there are 4 components of a panic disorder. Today I'm focusing more on, but I need to establish this to then talk about how you overcome a panic disorder. So beyond the bodily sensation, remember I said it's a surge of intense fear that is associated with bodily sensation. Now normally it's usually it starts and ends in a very short time. Those body sensation starts and ends very shortly, but after it occurs, some people then go on and they are worried that it will happen again. So they may not be experiencing any bodily sensation, but then they are worried that I hope that thing that happened, that attack, will not happen again. And then they are worried. And sometimes it's also because they are constantly worried, then it's then sometimes associated with sleep problems, inability to sleep. Sometimes panic attacks could occur in the night, could occur in the daytime, could occur at any time. But when there is an anticipation that will occur, once there's an anticipation that there's a possibility that will occur, then it is become a panic disorder, no longer just a panic attack. And so, but beyond the bodily sensation, there's also the thoughts. So I said there are 4 things. There's 1, hello back. Yeah, so there's 1, the bodily sensation. Then there is 2, the thoughts. The thoughts, okay, well, 2, I can say the emotions. The emotions will be that fear. So in dealing with it, which is what we're going to be talking about today, you need to understand the first thing in dealing with panic disorder is understand how it works. And that's why I'm talking about the various components. Understand that there are components of a panic disorder. There's the bodily sensation, very uncomfortable bodily sensation, very, very uncomfortable. But beyond that, there's the emotion, which is usually the fear, the intense fear. Sometimes it is the fear of dying, fear that this bodily sensation may mean that it's a catastrophic thing that's happening to them. When I say catastrophic thing, I mean that the person imagines that this sensation in my heart may be a heart attack, or this weakness I feel may be that I'm having a stroke, or this feeling in my head, this woof sound that just keeps blowing, or sometimes even the inability to sleep, that I hope I'm not dying. You know, there's so much fear that comes with it. So could you want to come on live on that? You just pressed that mistakenly, Daffy. You know, that's my big brother. There's the fear that goes with it. So there's the emotional part. First is the bodily symptoms. Second is the emotions that go with panic attack. The second component, I said there are 4 components. So there's the emotion that go with it, the fear of dying, the fear of being embarrassed. So someone may be afraid that if it happens, I may just fall down and embarrass myself, you know. And then there's also the fear of losing control. What if I lose control? You know, what if and then there's the fear also of losing one's mind. So many times people are afraid that, am I losing my mind? All these things that are happening to me, am I running crazy? So there's the fear of dying, the fear of embarrassment, the fear of losing control, the fear of losing one's mind. That's fear. That's the fear. Then the third thing is the thoughts. The thoughts. And all of this is very important because as I understand. So the first thing I said, the first thing you need to do to deal with anxiety or panic disorder is to understand it. And that's why I'm taking time to gradually explain the various components. That there's the bodily sensation, what you feel in your body. It could be, there are so much things that one could experience in his or her body. Then there is the fear or the emotions that goes with it. Sometimes the emotion of irritability, but most times the fear, intense fear. And then there's the thoughts that go with it. The thoughts could be, the thoughts just, what is feeding the fear is the thought. Am I dying? Am I losing my mind? Am I, no, this is something serious. This is a heart attack, whatever. Then finally, the fourth thing is the behavior. There are basically 4, but kind of basically 3, but you can extend it to 4. Number 1, types of behavior that go with panic disorder is something we call the escape behavior. when people begin to experience panic attacks or panic disorder, they want to always ensure they can escape. So someone may say to themselves, oh, if I go to an environment, I have to ensure I can escape in case I need to escape if I'm having a panic attack, or I need to, kind of. So there's that tendency to want to escape. They always want to search around and look around and make sure they can. The second thing is avoidance. So avoidance is where maybe the first time it happened in a particular place, or maybe while you were exercising, you started feeling your heart beat, and once your heart just started beating, the fear came in that maybe I'm having a panic attack. So after that, you now start avoiding to exercise, you avoid to go to certain places, you avoid certain kind of meals, because maybe when it first happened, you were eating a particular meal, and then it happened, like, oh, I need to avoid it. Or maybe it happened in a particular room, and then you begin to avoid. Or maybe it happened in your house. Some people, or maybe it happened in the night. So there's this fear, there's an avoidance. And then the third thing is something called a safety behavior. Safety behavior is where you keep checking. You may keep, there are various forms of safety behavior, but it could be that, okay, I need to go with somebody. If I'm going to XYZ place, I need to go with someone just in case I have a panic attack, just in case I collapse, just in case I need to get to the hospital. Some people, they have to constantly stay in the hospital. I've seen people with panic disorders that got so bad, and then you are kind of limited to certain places. I'm going to talk a bit about that very soon. My time is limited, but so the first and major thing is you need to understand panic attacks. Safety behaviors, you could get the number of the doctor and keep calling and feel the need to always reach out to the doctor. If I can only reach out to the doctor, I'll be safe. Or if I can only just get to the hospital, I'll be safe. So people with panic attacks often just go repeatedly to the hospital, and sometimes just stay there because there is a sense of safety being there. So those are the four components of this. So number one thing is understand panic, which I have tried to explain. Then number two thing is monitor it. So when you go into treatment, one of the things you'll be told to do is to kind of take note of what triggers it, who were you with, what were you thinking, what kind of emotions were you having, how often has it happened in the week. Monitor it. It's very important to always monitor it, to take out time to take note of those things. So you'll be told to do that in therapy. Don't be lazy about it. Please take out time to monitor it, to record it, record them, record your symptoms when they are occurring, record how often it occurs, and all of that. You will be required to do that. The third thing is relaxation techniques. I'm not going to go into that, but I'm just laying basic foundation. So they will teach you during treatment how to do certain things that will cause relaxation. Why is relaxation important? Panic is a form of anxiety disorder. It is what is happening with panic attack is, number one, your system, those who are experiencing it, have become hyper vigilant to their body. So they are constantly scanning. Am I feeling anything in my body? Am I experiencing anything in my body? And so there are just different symptoms that come up. So you want to, and then they sends a false alarm to the brain that, oh, we're in danger. All of those symptoms sometimes you are experiencing, they are normal reactions to threat. Heart beating fast. For example, if you go to jog, your heart is supposed to beat fast. But then when you jog, you feel your heart beating, your brain says, oh, I'm having a heart attack. And then the fear comes in. So you want to learn techniques on how to just breathe. So there's breathing exercise, there are meditations that you do, there's also progressive muscle relaxation. All these things are things you do before, during, and even after a panic attack, to just teach your mind to relax. Because when you do those things, when you do those breathing exercise or deep muscle relaxation, it also sends a signal to your brain that we are relaxed, all is well. And then your brain helps to take over and then kind of quietens down all of those bodily sensations that you are feeling. So that's one thing that you will have to learn. And interestingly, these things, you can go on the internet and read about them. They are easy self-help tools that you can do, and they are very effective. You can actually go on the internet and look out, and they are very effective. Number 3 thing is that one of the most important component of treatment and most important component of overcoming panic disorder are your thoughts. Your thoughts are the most important part of panic. Your thoughts, what you think, how you see, what your interpretation of those bodily symptoms that you are experiencing, your heartbeat, maybe from exercise, and then your mind, your thought says, I'm having a heart attack, or you feel a numbness and you say, maybe I'm having a stroke. So your thoughts will be your biggest challenge. I want to stress that because many people, when they go receive treatment for panic disorder, they are saying, doctor, treat my bodily sensation. Give me medication to stop those bodily sensations. I don't want to feel that headache. I don't want to feel that funny sensation. I don't want to feel that heat. I don't want to feel the numbness. I don't want to feel that. I don't want to feel anything. In fact, most people who have a panic disorder, because their thoughts, once they feel anything in their body, that weakness, they feel, oh, I don't want to feel that. And they think that all that needs the treatment should focus on is dealing with my bodily sensations. That's where medication comes in. Medication will help you sometimes to deal with your bodily sensation. But remember, there's bodily sensation, there's emotion, there's thoughts, and finally there's behavior. Your medication is not going to deal with your behavior. Your medication is not going to deal with your thoughts or your fears. They will deal with the bodily sensation. And many times people feel that as long as I don't have any bodily sensation, I'll be just fine. But that's often a wrong approach to treatment. So your thoughts, that's why the standard treatment protocol for panic disorder is called cognitive behavioral therapy. Cognitive behavioral therapy. So your thoughts are your most important component in dealing with this. And there are various techniques that is used to teach you how to manage your thoughts. One technique is called decatastrophizing. Decatastrophizing your thoughts. That's making that catastrophic thought, bringing it down. So there are techniques that are taught you on how to manage your thoughts. It's going to be difficult in the beginning. It's always easier to say, just give me medication and just solve my bodily symptoms and I'm fine. All this talk about trying to deal with my thoughts is too much for me to deal with. I can't handle that. Just give me medication. But sometimes medication will help remember, which brings me to like the final thing. So first thing I said is understand it. Number 2, I said monitor it, record your progress. Why it's important to record your progress is because sometimes, even when you are getting better, but still experiencing some symptoms, maybe for example, before you started out, you were experiencing like 5 times in a week. Now you're experiencing once a week. Your mind will tell you, oh, why am I still experiencing this? But when you record it and you put it in front of you, you can see that even though I'm still experiencing it, I am making progress. And sometimes you need to remind your mind. You need to tell your mind that. So understand it, monitor it, relaxation techniques, along with medication sometimes, most times actually, especially when it's very severe, to deal with the bodily sensation. Then your thoughts are the most important part. That is number 4. And the 5th and the final thing for our conversation today as a roundup on panic disorder. Next week, I'm hoping I get questions and I'll be able to answer specific questions. I don't say any question for today, but the final thing is your actions, your behaviors may be maintaining the problem. Remember I said that there are 3 major types of behaviors associated with panic disorder. Number 1 is something we call the escaping, the tendency to escape. Now the problem with all that is the problem with the behavior to escape, or the behavior to avoid, or the behavior of safety behavior, like I need to call the doctor, I need to be safe, I need to have someone with me, is that those behaviors, they give some form of relief in the immediate. In short term, you know, they help you deal, you feel safe. You feel like as long as I avoid that, or maybe you're having a panic attack. Many times, seeing people, they have a panic attack, they get up and leave the room. And once they leave the room, the symptoms come down. So in their minds, like, all I need to do is escape, and then I'm good. Now, in the short term, it solves the problem. The only problem is that in the long term, it kind of maintains the problem. So just those days, we used to watch this film. They say, mind your language. As far as when it comes to panic disorder, I would say, mind your behavior. So those are the 4 things. I hope these were helpful. You could go online and read up more self-help tools for those who may be struggling with panic disorder. It's often misdiagnosed, often, but I'm hoping this will really help people. These 5 things I've mentioned will help people. Like I said earlier, this is our 3rd year anniversary. Grace Hill Place Hospital, we are celebrating our 3rd year anniversary, and in celebration of our 3rd year anniversary, we are doing 30 free consultations for those who register. Just check my check this Facebook page and check also my Instagram page. You will see where you have to go register. You have to register. But the consultation is free. The registration is not free, but the consultation is free for 30 people, anybody at all. I mean, as long you have to register. So if you are already registered with Grace Hill, it doesn't apply to you. You know, so it is free consultation for those who, and any form of mental health issue, free registration. And also, one of the things I said I was going to announce is that as we turn 3, we're also happy to announce that we are moving to our 30-bed facility. As Grace Hill turns 3 years old, we're also moving to our 30-bed facility. So truly, God has been good to us. You know, so I just had to put that in. You know, so we celebrate 3 years. We're happy to celebrate 3 years. Grace Hill Place is a place where we treat mental health, mental illnesses, and also treat drug addiction. It's a drug addiction treatment center. So thank you so much for joining. See you next week on Monday. Spread the word every Monday, August and in September. Question and answers on mental health issues with Dr. Edebi. Bye for now.